Recent examples of human epidemics around the globe demonstrate that they have the potential to overwhelm already stretched health resources. To convey key information about this hazard, we spoke with the Department of Health's Dr. Donna Mack.
So a human epidemic refers to the situation when we have more cases than what we would normally expect of a particular infectious disease for that particular community or population in a particular region in a particular point in time. So you can see it's actually quite context specific. And so, for example, in a temperate climate like in Perth, we normally see a peak in influenza every winter. That's not considered a human epidemic, that's just considered normal because that's what we know normally occurs with influenza in temperate climates. But if, for example, we saw the same pattern of influenza that we see in tropical Australia, in temperate climates like Perth, where they have similar numbers of cases throughout the whole year, especially in summer as well as in winter, if that happened in Perth and our climate hadn't changed, then we would think, oh, well, that actually could be a human epidemic. That's unusual, that's not right. The groups of people who are more vulnerable to a human epidemic or any sort of infection are people who have a weakened immune system. That could be because they have an illness like cancer, or perhaps because they're on medicines that suppress their immune system. Could be because they're very young or very old, and we know those people have a poorer immune system. Also, if we think about people who are disadvantaged, like homeless people, Aboriginal people, people of culturally and linguistically diverse backgrounds, people who have poor access to health services. So they're more vulnerable to infectious diseases and therefore more vulnerable to a human epidemic. So we could think of getting an infection as well, you can get it from other people. So obviously if you're in overcrowded conditions, you might be more likely to acquire that disease. But we also know that human epidemics can start from infections being transmitted from animals to humans. And so we need to think about, people who are in constant close contact with animals. So for example, agricultural workers, people with lots of pets. And we can then think, well, actually they're everywhere around WA. And so in a way, no area is protected. And then given the frequency of air travel, we can really think, well, the whole of the state needs to be aware that they could be at risk and, not to be alarmed, but always to be alert and to be on the lookout if infections occur at a rate that's higher than normal or in a place which is unusual where we wouldn't expect them to happen. To start off with, I thought I'd just talk a little bit about the SARS outbreak. So although that only, that affected less than 500 people worldwide, but it had huge international profile and a lot of impacts because the case fatality rate was very high. It was 10%, and we only had one case confirmed in Australia. But the effects were felt very strongly because people were scared, they were worried about the high case fatality rate, and so people across the world, including in Australia, restricted their travel. And we found that international travel, reduced by about 50 to 70%, hotel occupancy reduced by about 60%, and that even affected Australia, where we didn't have lots and lots of cases. So, with that outbreak, we can see that people will change their behaviour, even regardless of what the government does or doesn't tell them to do, if they perceive that it's severe and it's something that's likely to affect them. Now, a few years after that, we had the swine flu H1N1 influenza outbreak, and the case fatality rate for that was 0.1%. Versus 10% for SARS, so it was a much less serious disease for the individual, but there were many, many more people involved, so tens of thousands of people were infected. And so that had a large impact because of the sheer numbers of people who were involved, and also the age group of the people who were most vulnerable. It wasn't the very young and the very old as what we would normally expect. In fact, the very old had a degree of natural immunity to this particular strain of influenza because it's one that they had met in their childhood. So they were relatively protected, and it was adults of working age who were mostly affected. So that really sort of caught people in their tracks and made people who normally don't feel very vulnerable to the effects of this infection. The other thing that occurred because of these people getting very sick with respiratory symptoms is that our intensive care units were really pushed to capacity in terms of looking after these people. And so you find that with health services, if they're pushed to capacity, then they have to deal with the sickest people first, and then things like elective surgery, things that are less urgent, get put on the back burner until after the outbreak is over. So if we're thinking about the consequences of the infection itself, well, it will clearly depend on what sort of infection we're looking at. There's a range of infections. They can cause respiratory illness, they can cause gastrointestinal illness, or diseases of the brain. So the actual effect could be quite wide-ranging. In addition to the effects of that infection on the individual person who is sick, we need to think about the effects more broadly. So there will be effects on the wider economy, because during a human epidemic, the people who are sick, and often the people who are around them in their family who've been in contact with them, will not be able to go to work. If you have a large number of people absent from work across a range of industries, that will affect the economy on a big scale. The other way in which it could really affect people is that if you have large numbers of health workers who are sick because they've been exposed to sick people, then the people who are sick may not be able to access the health care that they need. So that obviously will have a lot of flow-on effects as well. And then we have to think about the effects of the control measures that we put in place. And we would hope that most of these effects are positive effects that are helping to control the epidemic and keep people safe, and usually that is the case. However, whenever you put in any sort of intervention, there's always going to be unintended consequences of the intervention. Say if we say to people, look, it's really important that you stay at home and stay put so that you either don't get infected or you don't infect other people, that they have access to food and water and the supports that they need, because you really can't say to people just stay at home for more than a day or two without them thinking, well, I need to buy food. And we saw some of these unintended consequences during the H1N1 swine flu outbreak, when we said to children, who had either swine flu or were contacts of swine flu, it's important for those children to stay at home and not be in school. Perhaps that would have an impact on their parents because their parents can't go to work, and then that will affect the economy. That has flow-on effects to other parts of society, and it's, I guess, the reason why, whenever we have a human epidemic, we usually need to involve quite a lot of people from various organisations to fully think through, well, what do we need to do to control the infection? But more importantly, well, if we do this, what are going to be the effects that we want to happen? Are they likely to happen? And what could be the unintended effects? And how do we put some measures around that to make sure that we're getting more of the intended effects and fewer of the unintended effects? In terms of preventing epidemics, the Department of Health, along with other government agencies, like housing and water and sewerage, we have a role in keeping the environment safe so that we prevent epidemics occurring in the first place. In terms of preparedness for epidemics, the Department of Health has a disaster preparedness and management unit. And we run exercises with not just health services to make sure that they're prepared if an epidemic occurs, but also with other agencies. So, for example, St John Ambulance or RFDS, for medical evacuations, with the airport, because sometimes we need to institute border control measures. We may involve the police and other agencies in running exercises to make sure that we're all on the same page and we know what each other's respective roles are, so that when the time comes, we're not trying to make it up as we go along, but we actually already have well-developed relationships with each other, relationships of trust, and so we can then work together in a united way to control the epidemic. Then in the response to the epidemic, health services across the state, be they state government hospitals or private hospitals or general practitioners, primary health care, Aboriginal health services, they all have a really important role to play, depending on what the epidemic is. The nursing home sector as well, or the aged and residential care sector, is also very important because they have large numbers of people there who are often quite vulnerable to the effects of a human epidemic. Then if we have an epidemic that involves animal to human transmission of a disease, then we have to work very closely with the Department of Agriculture, and they would be involved. Another agency is the mass media, and now increasingly social media, that the health department needs to work hand in glove with them, because the community and the people who are vulnerable to the epidemic, it's really important that they know what's going on, that they're informed. And I think it's really important for the general public out there to realise that if a disease can be prevented by vaccination, that's really one of the most important and effective things that you can do to protect yourself and your family. And that if you are involved either as someone who has an infectious disease where public health services are instituting some sort of outbreak control measures, or if you've been in contact with someone who has a communicable disease and public health services are bringing you into the network of contact tracing and offering you some intervention to either stop you getting sick or to stop you passing it on to others, that you consider that seriously and think about the impact of that infection, not just for you and your immediate family, but for the broader society, and especially for people who aren't well and who have a poor immune system. So they're really relying on healthy people to be vaccinated, to take care of themselves, so that as a community we reduce the overall burden of infection. Then that will help to keep everyone safe. So as a society, if we can all do our bit to reduce the overall level of infection in our community, then we protect ourselves and also all these vulnerable groups as well.